Hey people, it's Nice talking. Now I'd like to bring you this story. This is from Daily Mail. Panic buying hits the US as anxious shoppers stockpile food and medical supplies as the number of coronavirus cases surged to 103. Shoppers have been scrambling for groceries at supermarkets in Brooklyn and Queens in New York. Social media videos have emerged of people panic buying at a Chinese supermarket in Flushing, Queens. Empty shelves were seen in grocery stores around New York amid fears of the spread of the coronavirus. New York had its first case of the virus confirmed on Sunday as the national cases hit 103 with 6 deaths. 2 deaths confirmed in Kirkland, Washington, as patients at Life Care Center at an Evergreen Hospital. Panic buying has hit the U.S. with anxious shoppers clearing supermarket shelves they stock up on food and medical supplies after the number of confirmed coronavirus cases across the country soared to 103. People started stockpiling items from stores across the country over the weekend as health officials confirmed the first 2 people had died in the United States from coronavirus. The 2 coronavirus-related deaths were confirmed in Washington state, including a resident at the Life Care Center nursing home and patient at the Evergreen Hospital. The spread of the disease, which began in China, has seen more than 89,000 cases worldwide and over 300,000 fatalities, prompting panic buying ever since health authorities warned that Americans should start preparing for domestic acceleration of the virus. Videos emerged on social media over the weekend of shoppers rushing to stock up on toilet paper, bottled water, disinfectant wipes, and sanitizer from California to New York. Shoppers were pictured lining up outside supermarkets in Brooklyn on Monday morning as New York Governor Andrew Cuomo confirmed details about the state's first case and warned the city would be testing for community spread. I fully expect to find community spread. You can't have it in this many places on the globe and in this many places in the country and it not be New York, he said. Supplies have been flying off the shelves countrywide with people posting photos on social media showing the lack of products available in some stores and pharmacies. In Southern California, some Walgreens stores have been completely depleted of cough medicines, cold and flu medications, vaporizers, masks, and thermometers. Shoppers in Hawaii were buying up flatbeds of canned goods, bottled water, toilet paper, and paper towels from a local Costco. A supermarket aisle in Virginia had been stripped of non-perishable items like pasta. Pictures of empty shelves at grocery stores elsewhere in New York also emerged on the weekend. It came as Governor Cuomo confirmed that the first coronavirus patient in New York was health care worker who was currently isolated in her Manhattan home. The statement from the Cuomo office revealed the patient, an unidentified woman in her late 30s, contracted COVID-19 while traveling in Iran. At least 91 patients in the U.S. have now been confirmed to have coronavirus after one was reported in Rhode Island and a 5th unknown origin case was found in Chicago on Sunday. Cuomo admitted the deadly virus entrance into New York's population of 19 million was a matter of when, not if. On Saturday, America's top doctor begged people to stop panic buying face masks, fearing a shortage could cause an even bigger threat if medical facilities could not access the product. Fun fact, I remember I posted this meme a while back where someone said, oh, it's going to be good when they get these face masks, and all the face masks are made in China. Anyway, let's keep going. Surgeon General Dr. Jerome Adams tweeted, seriously people, stop buying masks. They are not effective in preventing general public from catching coronavirus. But if healthcare providers can't get to them to care for sick patients, it puts them and our communities at risk. The best way to protect yourself and community is with everyday preventative actions like staying home when you are sick and washing hands with soap and water to help slow the spread of respiratory illness. Scroll down. Panic buying in the United States does not yet resemble what Italy witnessed in recent days, where supermarkets were stripped bare and videos posted on social media showing consumers coming to blows over bags of pasta. But there is a growing sense of urgency for people to stock up on staples and prepare for lengthy home quarantines. I'm buying some flu therapy and painkillers. If I wait until next week, there may be nothing left, said Dean McKnight, an engineer in Austin, Texas. He motioned to shelves at the H-E-B supermarket that were empty of several over-the-counter medications, primarily flu treatment for children. McKnight worked in Hong Kong and China during the SARS outbreak and knows firsthand the stresses that snowballing fears of a pandemic can cause, but saying he's not panicked. He added, we got an extra month's worth of inhalers for my wife, but we're not stocking up on medications or food, as if we expected to need to secure several months of supplies right now. Panic purchasing has been seen on masks and other personal protective gear. But it is also a looming threat to retail across the board, analysts said. Several major retailers, including Walmart and Target, stand to see supply chains badly hit by the coronavirus, and that could result in some empty store shelves starting in April. Ed Kelly, an analyst at Wells Fargo Securities, wrote in a research note this month. Kelly wrote, "We believe the time to start worrying about the supply chain of 2019 nCoV is here. It's worth noting that big box players like Target and Walmart could be the first to experience out-of-stock issues. That is because these stores operate on a just-in-time inventory model and are highly dependent on China, where supply chains have been badly disrupted. See what I told you? Stockpiling in states like Hawaii and Minnesota was spurred by messages from state health departments urging residents to buy supplies of non-perishable foods, prescription medications, and sanitary supplies." Fun fact I want to share with you. You know, diseases spread in crowded environments like public transport systems. So all these people going to Target, Walmart, and shops are making themselves more vulnerable to get sick, because if there's one person who's infected and they sneeze in an aisle filled with sick people, everybody's infected, or potentially. But you can't argue with stupid people. The advice contradicted the message from the U.S. Centers for Disease Control and Prevention, CDC. CDC Director Robert Redfield on Thursday told a U.S. congressional hearing that there was no need for healthy Americans to stock up on any supplies. Robin Gershon, a clinical professor of epidemiology at New York University, said, "We should have one unified message. When there's an absence of a good, strong, and reassuring official voice, people get more upset and start doing this magical thinking." It's like he's saying, thinking is magic. Don't think. We need a voice, the voice of government, to tell people what to think. They're too stupid to think for themselves. Well, let's keep going. On Friday in Honolulu, Hawaii, retired telecommunications worker Dwayne Tanui, 62, waited in line outside a Costco with more than 200 other people. "Nobody's really panicking, but there's a lot more people than normal," Tanui said by phone. Stores in Hawaii had begun limiting how much consumers could buy of some products such as toilet paper, he said. The Washington State nursing home where the second U.S. man died from coronavirus was slammed by worried families as it emerged the facility had a history of failing to control the spread of illnesses. Other relatives of residents claimed their phone calls would not be answered by staff and their concerns mounted. 6 coronavirus cases were confirmed at a life care center in Kirkland, including a resident in his 70s who later died in hospital. More than 50 staff and residents have shown symptoms and will be tested, officials said on Sunday. The man in his 70s had underlying health conditions and died at the Evergreen Health Hospital on Saturday. This is the same hospital where a man in his 50s died on Friday night to become the U.S. first coronavirus-related death. Anyway, there's more to this article, but, I don't want to keep going on. I'll leave it in the description for you to read the rest. And anyway, my advice to anyone, if you want to really look after your health, get limes or lemons and ginger powder and mix them together in some warm water with a little bit of honey squeezed in and drink that every day. If you want to stock up on anything, get black seed oil. I remember I was always told the Prophet Muhammad said it's a cure for everything except death. If you want to get some black seed oil. And one of the things I learned from Instagram that's really great for my personal health is something called golden milk. Now, I'm not sure if you could use actual milk, but what I do is I use the recipe. You use coconut milk, you use coconut oil, you use turmeric powder, I think it's coconut milk, and I put in honey and ginger powder. I mix it together, and it's great. It's good therapy. Like when you get a throat infection, it slowly helps you get better. And I take that at least every 2 days. You warm it in a pan together until the coconut oil melts. It's delicious. I would recommend it for everyone, especially on a cold winter day. It's fantastic. Anyway, please comment, rate, share, and subscribe. If you want to, I'll leave this article in the description. If you want to support this channel, leave my GoFundMe there. If you want to follow me on Instagram, you can follow me there as well. Peace.